homes and retirement homes. We're going to test more hospital patients, more frontline healthcare workers.
We know this is a wildfire that's raging in chronic care institutions. We need to put it out, and we can't put it out if we can't see it.
Stung by controversy over its COVID-19 testing numbers, Ontario rolls out a new strategy with a focus on testing those who are most vulnerable and at highest risk from the disease. Good evening, I'm Mike Wise. Thank you to viewers around Ontario for tuning in tonight. After a week of scrutiny over declining testing numbers, Ontario made some major changes to its COVID-19 guidelines today, saying it will increase testing by targeting high-risk groups. But will it be enough to truly show the scope of the pandemic in Ontario? Ellen Morrow has the latest.
At night, you're running a high fever and you're thinking, what is it? What is it? Am I going to make it? Am I not going to make it?
Aliona Besanoff has been sick in bed for weeks. She's one of many Ontarians refused a test for COVID-19.
Like, there's so much dependent on that test, and unfortunately, you don't get any answers, right? You just basically take one day at a time and do the best out of it.
Ontario has the lowest rate of testing per capita across Canada. Today, the province detailed plans to fix that. Its goal now, 16,000 tests a day by early May.
The sooner we can identify cases, the sooner we can act, contain cases, and stop the spread.
Can I send someone over for... To do that, Ontario will focus on testing high-risk groups like healthcare workers and first responders.
All right, this one's a fun one.
Testing is also being expanded in long-term care homes. Now the province says all symptomatic residents and any residents who may have come into contact with a case should be tested.
We are doing extensive testing there because this is such a vulnerable population.
But critics say the new guidelines aren't extensive enough. They argue that all long-term care residents need to be tested for the virus.
We know this is a wildfire that's raging in chronic care institutions. We need to put it out, and we can't put it out if we can't see it.
Ontario has struggled with testing. First a backlog, then not meeting capacity. The impact?
The testing has been such a mess for so long that we really are relying on lagging indicators to tell us where we are in this outbreak.
While the new plan is set to get more people tested, it likely won't help Aliona Besanoff, who isn't in a priority group.
If you do know it's COVID, I guess you know it and you deal with it. If you know it's not, then you get this huge relief.
Like so many, she may never know either way. Ellen Morrow, CBC News, Toronto.
The province is also updating the list of symptoms that could qualify someone for a test. On top of the usual dry cough, fever, and difficulty breathing, the expanded list now includes a hoarse voice, difficulty swallowing, loss of sense of smell or taste, diarrhea or nausea, and vomiting. Now, in the case of seniors, additional symptoms include chills, delirium with no other obvious reason, falls, increased heart rate, and decreased blood pressure. And it was just a week ago that the province was forecasting an urgent need to add hundreds of ICU beds in order to handle a surge in COVID-19 patients. However, as of tonight, the number of patients in intensive care is significantly less than projected. But experts say that doesn't mean it's time to let our guard down. Angelina King has more.
Yesterday was a hard day, but that time with him was probably the most peaceful moment that I had.
A moment Dr. Nadia Alam shared online. She was caring for a 72-year-old COVID-19 patient. She then helped him call his family and says as of this morning, he was still in hospital, but he's chosen not to go on a ventilator.
He turned to me and said, if I die from this, I would rather die looking at the sky. I would rather die talking to my family. And so I sat with him and we looked at the sky, and it was a beautiful sunny day.
He's one of 673 patients with the virus in Ontario hospitals as of yesterday afternoon. 260 are in intensive care. 83% of them are on ventilators. That's much fewer than the province's best case scenario projection from last week, which said there could be more than 850 people in the ICU at this time.
I would caution anyone to get overly optimistic that things are turning the corner. We still have a long way to go here.
Dr. Detsky says there are plenty of beds at Mount Sinai Hospital, but the ICU there is waiting with some anxiety for a possible surge.
Our group feels ready to take this on, but again, we won't really know until we're living it and experiencing it firsthand.
The province projected a peak in ICU demand at the end of next week of more than 1,200 patients, so hospitals are getting ready, redeploying staff, freeing up space, and planning strategies.
How will you move patients around, how you distribute those coming into the various centers to make sure that one is not more overloaded than it can take.
The province says modelers are looking at updated numbers and are expected to release new projections, but remind us that modeling is just that, a projection that isn't always accurate. Angelina King, CBC News, Toronto.
A Markham facility that cares for adults with developmental and physical disabilities is putting out an urgent call for help tonight after an outbreak of COVID-19 caused staff to go home.
We read early this morning that staff had walked out last evening, so we're quite concerned this morning.
Well, there's some family members of a resident at Participation House reacting to the news that 10 residents and 2 staff members have been diagnosed with COVID-19 at the location. It's near Highway 7 and 9th Line. Management at the facility says a number of staff walked off the job last night and that it is now in a state of emergency. The facility needs support staff and personal protective equipment. And our cameras were there today as a Markham MP dropped off boxes of gloves and masks. Tonight, Markham's mayor says he's been overwhelmed at the response.
Had a terrific response. Companies donating face shields for the workers there. They have a shortage of gowns. Gowns have come forward from different companies. It's been a wonderful response by individuals, by businesses, and some community organizations. That being said, I just can't believe we're in a situation like this.
Scarpetti says this is actually the 3rd time in the last week he's had to put out a public appeal for protective equipment. He says when this crisis is over, he wants a full review of how healthcare facilities in his community are equipped with protective supplies. It's not just the 2 staff at Participation House. More than 600 healthcare workers in Ontario have now tested positive for COVID-19, including staff at several hospitals. Those latest numbers come as frontline staff across the province are juggling a sense of duty and growing anxiety over what's to come. Lauren Pelly has the latest.
This patient presented to us very sick and so needed to come directly to the ICU, needed to be placed on a ventilator almost immediately.
Dr. Vatsal Trivedi says treating his first patient with suspected COVID-19 felt surreal.
A lot of people describe it as you're watching from the edge of the shore as a tsunami is coming towards you.
Already, hundreds of COVID-19 patients are filling Ontario hospitals.
It's easy to say that it makes us nervous or it makes us uncomfortable, and of course it does in a way. There's nothing about us that is unique in terms of our own bodies. We're at risk of the same infections that everyone else is in the world.
There is a growing weight on healthcare workers' shoulders as the number of COVID-19 patients in Ontario keeps rising. And so far, more than 600 healthcare workers themselves have also tested positive. One frontline worker has died from the respiratory illness, a 58-year-old man who worked at Brampton Civic Hospital. A CBC analysis also found multiple other hospitals across the province now have confirmed cases among their staff, including at least 4 in Toronto. Provincial officials are pushing for more protective gear.
Well, we have to make sure that everyone has the PPE items that they need, and we're stocking up.
But this physician advocate says the timelines aren't clear.
It's because right now community clinics don't have PPE. And many hospitals across the province, including in the communities where I practice, they're rationing PPE or there's not adequate PPE. Many hospitals are actually locking up PPE.
Trivedi says there will always be some level of risk, but he hopes it doesn't get worse.
What we can change and what we can do differently to change our risk is protecting ourselves, and I think as long as we do that, I at least can rest easy knowing that I've done all I can to protect myself and our team.
Lauren Pelly, CBC News, Toronto.
Well, some welcome news for parents with children in daycare. The province now says those facilities can no longer charge fees as long as the centers remain closed due to the pandemic.
This has created some strain on a lot of parents in the province, working people who have automatic withdrawals of hundreds or thousands of dollars per month for childcare, for licensed childcare in the province. And so, in consultation with Cabinet, the Premier is announcing and confirming that an emergency order has been signed and is in effect.
Now, during the COVID-19 outbreak, the government is temporarily preventing childcare centres from collecting payments from parents. Now, that also means that parents will not lose their childcare space because they're not paying those fees during this time. Most childcare centres were ordered to close to prevent the spread of the virus and keep children and childcare staff safe. There were a few exceptions that stayed open to accommodate healthcare and other frontline workers. The province is now asking those centres to seek financial aid through the federal government's relief plan. The Education Minister also says the province is still on track to have schools start again in May, but says that could still change. Researchers in the nation's capital are trying to find ways to safely reuse face masks worn by frontline workers. They're calling it an insurance policy in case supplies run low. Omar Dabagi Pacheco has more.
The hospital's wrestling with the question of what do you do if the masks run out? Now, they're not asking frontline workers to recycle those masks just yet, but they are asking them to hold on to them as they look into ways of possibly decontaminating them for later use. A group of medical students have been looking into thousands of studies into the decontamination of used masks. Basically, they're trying to prepare for a worst-case scenario where they might run out of masks. And last week, they shared their findings looking at the virus-killing power of UV light and the virus-killing power of heat. What they discovered was this: processes like microwaving or using a combination of heat and pressurization can kill the virus, but they can also destroy the disposable masks.
A lot of the degradation, as I said before, it was very specific to the model of the mask. So it is possible that these methods might work very well on certain mask models and not on others.
The question is whether the N95 mask needed to protect against COVID-19 will tolerate that process. Now, next week, researchers here in Ottawa are going to turn to another method. They're going to research the process of chemical decontamination, hoping that that may provide a tool to reuse the masks for frontline workers if it comes down to that. Omar Dabagi Pacheco, CBC News, Ottawa.
Well, since the federal government began taking action to fight the spread of COVID-19, there have been questions about when or if Ottawa will implement the Emergency Measures Act. It gives the federal government sweeping powers to manage the economy and restrict personal freedoms. Today, the Prime Minister said that would be a last resort.
If at one point those measures are insufficient to do the things that are needed to do, and all the tools that the federal government has at its disposal are insufficient to bring forward measures that are deemed necessary, then and only then do we consider the Emergency Measures Act.
Trudeau says the provinces and territories have their own emergency powers. He says Ottawa would only step in if those become ineffective. The OPP is releasing a new video in Spanish aimed at informing migrant workers about COVID-19. Each year, about 10,000 people from other countries work in greenhouses in the Leamington area. Most of them come from Spanish-speaking countries in South America. While many are already here on a 2-year work program, some are just arriving now. To make sure the workers understand the rules of quarantining and physical distancing, the OPP partnered up with the Migrant Workers Community Program to create a video in both English and Spanish.
Because there is not a lot of communication, or there is nothing in Spanish for them. So that was an idea from the OPP to create a video in Spanish to reach the whole community, and especially the community who speaks Spanish.
Barea is also posting information to the program's Facebook page in both English and Spanish to keep the workers informed. Well, Colette Kennedy will join us after the break with a look at your local forecast for this long weekend from Windsor to Toronto to Ottawa. Sun, showers, even some more flurries, I'm afraid. We're back in just a few minutes. Well, as kids wait for the Easter Bunny this weekend, a rabbit rescue group says the pandemic is causing a sharp spike in the number of abandoned pet rabbits.
In the last month or so, it's off the charts. So in the last 72 hours, we've had over 10 dumped bunnies. And this is just, we're just one organization and not everyone knows to contact us. So I can't imagine the numbers out there that we're not even aware about. So it's becoming a real serious issue.
Normally, her rescue fosters about 30 abandoned domestic rabbits. Since the pandemic hit, that number is up to 50 and it's climbing. Porter says she thinks this jump is due to people looking to pare down their expenses, but there may be some help on the horizon. In response to the pandemic, the Ontario Humane Society announced a new urgent animal care fund. It will help out sick or laid-off pet owners with vital services like pet food or vet visits. The Society says it is looking for donors to help top up that fund. Colette Kennedy joins us now live from the Weather Center. This is the weekend, of course. Colette, the Easter Bunny will be making the rounds. It's declared an essential service.
That's
and of course,
right.
Mother Nature is going to make it a lot easier for us to not want to venture outside much.
Yeah, the best place going to be on Easter Sunday and Easter Monday is right at home, to stay at home. I want to welcome in our viewers from the nation's capital region, of course, through southwestern Ontario, our friends in Windsor as well. So kind of some broad strokes here, just to give you an idea over the holiday weekend. We're looking at the best day in terms of our weather conditions being on Saturday, okay? Because Sunday through Monday, it depends exactly where you are, but in general, 15 to 30 millimeters of rainfall we're looking at. And then as cooler air eventually makes its way in, because it will be mild at first, then we're going to get into some flurries or some mixed precipitation late on Monday, and definitely Monday is going to be a very windy day. I'll illustrate that for you in just a moment. We've had several mild days. Well, today the atmosphere kind of saying, hey, cool it, let's cool things down. So these are your current temperatures. Our temperatures actually highs were a little bit below seasonal today, but high pressure is coming in, and that's what's making things nice for tonight and for Saturday. We'll have quite a bit of sunshine, and then later in the day, the cloud cover will begin to build in. Now, I want to show you, there's that exiting system. We are still seeing wind gusts from Barrie through the GTA towards St. Catharines at 50 to 60 kilometers an hour from the northwest as that low departs, but high pressure builds in. When you see these lines, these are areas of equal barometric pressure. When they get stacked up like this, we have those windy conditions. So the winds back off for Saturday, but just watch out. Precipitation begins to move in as showers as we go late overnight Saturday into Sunday, somewhat spotty in nature. It starts to get breezy, and then look at these lines stacked up again. Yes, we're talking about very low pressure here, and those winds will be blowing along with those rain showers as we go, especially Sunday night and through the day on Monday. A little bit of mixed precipitation, as I say, because of the colder air that'll come in. But before that, we're going to see our temperatures into even the low teens, it looks like. But have a look at these wind gusts. This is as we go towards the afternoon on Monday. Even St. Catharines, maybe exceeding 100 kilometers an hour. I do anticipate we'll see some wind warnings go into place for southern and eastern Ontario as we get closer to the event, but especially for the lower Great Lakes region. So first of all, Toronto, looking through your weekend, through the afternoons and the night times, look at some of these temperatures Sunday afternoon, 10 and then 14 on Monday, but again, with rain going sideways, so you'll want to stay inside. This one for you, Ottawa, by Monday, you're going up to 14, and then the cool down comes, and for our viewers in Windsor, 12 degrees tomorrow, just a beautiful day on Saturday, but wet conditions. And yeah, staying inside for those Easter egg hunts, it's going to be where you're going to want to be, Mike.
Good advice. Thank you, Colette.
You're welcome.
The weather update is brought to you by Train, the most reliable heating and cooling brand. It's hard to stop a train.
This Good Friday, the Pope celebrated Mass in a near-empty St. Peter's Basilica. Restrictions at the Vatican during the pandemic meant just the Pope and a few other clergy actually took part. Traditionally, this service draws nearly 10,000 faithful, including cardinals and bishops. Another change because of the ongoing pandemic, only the Pope kissing the crucifix today. Usually the cardinals and bishops would as well at the end of the service. And the faithful in France had to watch this remarkable sight From a distance, Notre Dame Cathedral in Paris has hosted many Good Friday services over hundreds of years, but this one will certainly go down in history. It's the first since that devastating fire broke out a year ago next week. After the break, today's frontline hero. Stick around for that. We'll be right back. Well, the person who told us about Dr. Anne-Marie Zadlik doesn't even know her. We got an email from a viewer who said she wanted to thank a Guelph doctor for bringing her comfort by sharing messages of hope on her Facebook page. Well, we got in touch with Dr. Zadlik to find out why she's making those posts a priority. We found out she's not only a family physician, but a regional HIV specialist as well. And she says experiencing that pandemic has given her a whole new perspective on this one.
When I was starting to treat HIV-positive patients in the early 90s, we still didn't have a treatment, so the patients I was caring for were all dying. It was before 1996 when the drug cocktails were available. And we knew how the disease was transmitted, but there was still a lot of terror around whether or not the disease would be transmitted to healthcare workers. So what I had to learn to do was not be concerned about the disease being transmitted to me, but to move forward and help as much as I could with people who were living with the virus. So it seems natural to me with that training to sort of run towards the fire and into the COVID-19 pandemic, because that's what I was trained to do. So that part for me is not difficult. What I find very difficult is just how much panic is out there, and how that panic and anxiety can be far worse for all of us than the actual pandemic. And if I can help in any way to solve people's or to calm people's fears, that's what I hope to do. Like, to me, this is like, people need to understand how brilliant human beings are, how wired we are for resilience and survival, and how intelligent we are, how many resources we have that we can use against this pandemic. We've been able to mobilize global resources and information technology science to find a 1 pill once a day regimen that allows a person with HIV to live a normal life expectancy. And we're just years away, I think, less than a decade from finding a cure. So I've watched a world rally together and collaborate to fight HIV. So I'm very confident that we're going to be able to fight COVID-19.
Well, thank you for all the work that you have done. That's our show for tonight. Thanks for joining us. Have a great Easter weekend. Good night.